An FDA advisory panel has officially endorsed booster shots for all 3 coronavirus vaccines available here in the U.S. The group voted Friday to recommend a second shot for millions of recipients of the Johnson & Johnson vaccine. The decision comes one day after the panel greenlighted Moderna's booster for vulnerable populations. So far, more than 5% of the fully vaccinated people in the U.S. have received a booster shot. Earlier this week, the head of the World Health Organization called the increased use of boosters immoral, unfair, and unjust as poorer nations struggle to get their first doses. Mireya Villarreal begins our coverage in Texas.
More than 15 million Americans who received the Johnson & Johnson vaccine are now one step closer to a booster shot.
We do have 19 out of 19 unanimous yes votes.
In contrast to the Pfizer and Moderna recommendations, the panel is suggesting all adults 18 and older who got the Johnson & Johnson vaccine get the booster as early as 2 months after their original shot. But the panel also heard concerns about the overall efficacy of the J&J vaccine.
All of the data do not fully align with this being a vaccine that retains excellent activity over time.
Is there a concern that this creates confusion for people who are maybe on the fence?
This is actually how science works. And you want us to do that. I mean, you want people to update guidance based on new data and new evidence. And my hope is it doesn't breed distrust, but in fact makes people realize that this is a good part of the process.
On Thursday, the CDC added mental health disorders, including depression and schizophrenia, to the list of underlying conditions for those eligible to get a booster. Meanwhile, the Wall Street Journal is reporting the FDA has delayed a decision on whether to authorize Moderna's vaccine for kids 12 and up. The agency reportedly wants more time to assess any potential risk of the rare inflammatory heart condition, myocarditis. More than 68,000 people in Texas have died from COVID-19, and doctors worry the state could soon lead the nation in mortality rates. An executive order recently issued by Governor Greg Abbott bans private businesses from imposing vaccine mandates.
Governor Abbott and our elected leaders in the legislatures should be doing everything they can to save lives. And that's getting more people protected via vaccination, not taking away the tools we have to do so.
Here in the heart of downtown Fort Worth, health officials are hoping that pop-up clinics in busy areas like this one right here will get more people vaccinated in this state. The CDC is set to meet next Thursday to discuss the boosters, but the earliest Americans will be able to get these boosters for J&J and Moderna will be Friday of next week. Lana?
Mireya, thank you. For more, I want to bring in Dr. Taison Bell. He's an assistant professor of medicine at the University of Virginia. Dr. Bell, always a pleasure. So an FDA panel unanimously endorsed booster shots for millions of recipients of the Johnson & Johnson vaccine on Friday. Tell us what these experts considered before making their decision.
Well, thanks for having me on. And I think this is good news all around for those who received Johnson & Johnson, about 15 million Americans, because the data clearly showed that while the vaccine is still very good, it's clearly inferior when you compare it to the Moderna and Pfizer vaccines. And so a lot of folks who have received Johnson & Johnson were really anxious and wondering what to do. And I think this guidance from the FDA at least lets them know that that boosters can be given 2 months or after. I think the question that remains, though, is that the data also shows that if you consider boosting with the mRNA vaccine, the Pfizer and Moderna, it looks like the response is actually better than if you boost with the Johnson & Johnson. So the FDA did consider this, but unfortunately didn't vote on it. And so it's a little unclear what to do.
I really want to ask you about that because, as you mentioned, this was a recent NIH study that concluded that mixing and matching booster shots may not only be safe and effective, in some cases, it might actually offer a better immune response. I do think we have to probably say that this study has not yet been peer-reviewed. So what came out of Friday's discussion, and what would you recommend then to somebody whose initial shot was Johnson & Johnson and might be thinking, it's time for a booster, but maybe I should wait and get one of the other ones?
Yeah, and I wish we had some guidance when it comes to that. I think when I look at the data myself and speaking with colleagues, I think if we had received Johnson & Johnson, I think our preference would honestly to receive a Pfizer or Moderna booster just based on the levels. I think the greater point, though, is that the vaccines are still very safe. They're very effective. And even though the Johnson & Johnson vaccine had lower efficacy compared to Pfizer and Moderna, that efficacy did hold up a little better over time. And so I think when we're considering boosters, we're mostly talking about preventing symptomatic disease, unless we're talking about high-risk populations. But these are still questions to sort out. But I think in the meantime, the assurance that the vaccines are still working very well is the message to really get out.
Dr. Bell, as you know, we talk at length about the consideration for a pediatric vaccine. And we know that also that the FDA panel is going to be convening later this month to actually consider Pfizer's vaccine for kids aged 5 to 11. Tell us not only how important their decision would be, but remind us what we know about the pediatric vaccine. And as we heard Mireya's report, the risk of myocarditis in younger populations.
That's a fantastic question, because I've been getting this a lot from parents. And as a parent of a 7-year-old and a 3-year-old who are outside playing right now, that date is of October 26th is circled on my calendar. And I'm very anxious to await what the decision comes. I expect that we will have vaccine approved for Pfizer for children aged 5 to 11. But to put this into context, luckily, when it comes to the Delta variant, we do not see children have high rates of severe disease, although we've seen that children have been more affected. But I think it's important to point out that the risk of remaining unvaccinated is also important to consider. We've talked at length about the risk of myocarditis or heart inflammation, but having COVID-19 actually carries a much higher risk of inflammation of the heart than the vaccines themselves. And so I think when we're considering the health of children when it comes to long COVID, preventing spread, and other conditions like myocarditis, the evidence heavily favors getting vaccinated.
I know you and I are both looking at the end of October for our kids. Let me also ask you, though, because nearly 2 in 3 eligible Americans are now fully vaccinated against coronavirus, but the average pace of first doses for adults and older children has really been falling for over a week now. Are you concerned about that, or do you really think that that's in line with what you would expect at this time?
Well, I just left the ICU a couple hours ago, and we continue to admit patients who are unvaccinated with COVID-19, including those who are young and completely healthy. So as much as we're talking about boosters now, we do have to keep our eye on the prize, and that primary vaccination is still the thing that we need to do if we're going to make sure that hospitals are not overwhelmed and that we don't continue to have people dying from COVID-19. And so as much as we can do to encourage or even require vaccination, that's really what we need to do. And so seeing news like what's happening in Texas, preventing businesses from keeping their work environment safe, that's not the direction that we need to go at this point.
Dr. Taison Bell, thank you, as always, for being on the show, and thank you for all that you do.
Thank you, Lana.